Coronary stents can be a lifesaver, but critics suggest that in some cases they may be overused. Dr. David Mischel joins us to talk more about stents and to answer your questions. Thank you for joining us this afternoon.
Thank you for having me.
Explain what they are and then what they're used for, if you would, please.
A coronary stent is a little stainless steel slotted tube that is mounted on a balloon, and I actually brought one in here today, and it's attached to an inflation device, and you can see that this is quite small. And if we blow up this inflation device, the balloon may be difficult to see, but is inflating, and that stent will expand and will stay lodged.
We are getting a close-up. Hold on, Dr. Mischel. This is actually the stent.
That's the stent mounted on a balloon, and when we withdraw the balloon, that stent will stay in the artery and act as a scaffold to keep that artery open.
How do you determine when someone needs to have a stent?
Well, there's the acute situation where somebody may be suffering from a heart attack, and that's a life-threatening emergency, and that is a perfect indication where stents are life-saving and effective.
But so they will decrease the chances of someone having a heart attack?
In the throes of a heart attack, it will save a life. The question is, if somebody has stable coronary disease, is it going to save lives or just improve symptoms?
So is that considered a drawback?
It's considered a drawback that whenever you put in a stent, there can be acute and long-term complications. So if we're only trying to improve quality of life, that may not, that certainly will help improve quality of life, but it may not save your life in stable patients.
So when do you determine someone needs a stent?
Well,
or maybe I should say who should and who should not.
Everything that I say is in generality, and it can't replace a one-on-one conversation with an experienced and thoughtful cardiologist who looks at your lifestyle, who looks at your symptoms, and who looks at what other options are available, such as medications or heart surgery.
Are they permanent?
Are stents permanent? Stents are permanent, yes.
In what instances are they more likely to produce your desired outcome?
I think if a patient is unstable with a life-threatening emergency, they are indicated. I think the question arises if somebody has elective symptoms that's hampering their quality of life.
Let's talk about quality of life. Can people avoid these problems in some cases? Are there lifestyle changes that can be made?
Absolutely. We have to concentrate on diet, healthy eating, exercise, and staying thin, and that can prevent blockages from worsening.
And what are some of the other options if it's not a stent, such as surgery?
Open heart surgery is an option, and it's very effective when multiple arteries are involved or if the heart is slightly damaged. As
we wrap this up, Dr. Mischel, do you think that the question is, in some cases, critics say they're overused? Are stents overused, do you think?
I think stents were overused in the past because we didn't have good trials and studies showing that medications and lifestyle changes can also be quite effective.
But in fact, they can be lifesavers and are very important in your arsenal of treating patients, aren't they?
I couldn't have said it better.
Oh, well, thank you, Dr. Mischel, from your new assistant. Thank you for joining us this afternoon. Boca Raton Regional Hospital sponsors our doctor and also underwrites our Ask the Doctor segment. We're back with more in just a moment.